Hi, Eileen Veilleux The Fam here. Welcome to another installment in our mini mental health series. And in this installment, we will be finishing up on ODD, which is Oppositional Defiant Disorder. And we will be covering the diagnosis and treatment for ODD. Before we begin, let me just remind you to please watch the full video because throughout the video there will be 3 keywords. When I get to the keyword, I will say keyword and then what the keyword is. At the end of the video in the comment section, along with the genuine comment about the video, put in the 3 keywords that you hear throughout the video to be eligible for my free merch giveaway when I reach 2,000 subscribers. So let's get started. According to the DSM-5, oppositional defiant disorder, better known as ODD, is a pattern of angry, irritable mood, keyword, argumentative, defiant behavior, or vindictiveness that lasts at least 6 months. It typically starts in childhood and manifests in interactions with others besides siblings. ODD varies in severity. The DSM-5 features 3 categories. Mild, where symptoms are confined to one setting, such as home, school, or with peers. Moderate, where some symptoms are present in 2 settings. And severe, where some symptoms are present in 3 or more settings. Parenting a child or teen with ODD can be really frustrating, confusing, and overwhelming. Fortunately, there are a number of effective treatments along with valuable tools and techniques to help you. Psychotherapy is the best way to treat ODD, and medication may be prescribed for aggression or irritability or for co-occurring conditions. Example, ADHD. Overall, your child's specific treatment will depend on several factors, including their age, severity of symptoms, and presence of their disorders. It's important to note that ODD isn't exclusive to kids and teens, and symptoms do continue into adulthood. For example, ODD has been found in clinical adult samples. A 2013 study found that individuals with both ADHD and ODD had greater impairment on measures of ADHD, personality disorders, and substance abuse when compared to adults with ADHD alone. In 2018, another study found links between ODD symptoms and greater social impairment in conflict with authority figures, such as teachers and managers. More frequent thoughts about dropping out of college and arguments with parents, and difficulties in romantic relationships. However, research is only recently starting to explore ODD in adults, and there's little to no data on effective treatment. One of the ways of treating ODD is through psychotherapy. Now, psychotherapy is the main treatment for ODD, or oppositional defiant disorder. Parents play a pivotal role in helping to change your child's behavior. The most commonly used interventions fall under the category of parent management treatment, which is abbreviated as PMT. Now, PMT is based on the work of General Patterson and his colleagues who viewed ODD as a pattern of learned behavior that's fostered by keyword negative interactions between children and their parents. PMT interventions use rewards and consistent consequences to shape behavior. Their aim is to foster positive relationships between kids and parents, along with increasing adaptive behaviors and decreasing disruptive behaviors. These are some examples of PMT. Parent-child interaction therapy is for kids 2 through 7. It includes 2 phases. The first phase focuses on cultivating warmth in your relationship with your child. And the second phase focuses on learning effective tools to manage your child's most challenging behaviors. Specifically, you and your child are in a room together with the one-way mirror, while the therapist is in another room and coaches you through a headset. You can learn more about PCIT at their website and find a provider there. Positive Parenting Program, or Triple P, can be used with toddlers and teens. Triple P has multiple levels which are matched to your child's problem severity. According to a 2019 chapter in the Cincinnati's Guide to ODD, Triple P teaches parents 17 core parenting skills. Example, talking to children, physical affection, attention, setting limits, planned ignoring, to increase positive behaviors and decrease negative ones with uses of planned practice activities. You can learn more on their website and purchase either a course for toddlers to tweens or preteens and teens. Another one is helping the non-compliant child. This is for 3 to 8-year-olds. It features 2 phases. Differential attention and compliance training. In phase 1, parents cultivate a positive relationship with their child and learn concepts such as using rewards and ignoring minor inappropriate behavior. In phase 2, parents learn to provide clear, concise instructions, use consequences for compliance, example, positive attention, and non-compliance, example, timeout, and apply these skills in different situations, example, riding in the car. The intervention is outlined in the book Parenting the Strong-Willed Child by psychologist Rex Forehand. The Incredible Years aims to cultivate a positive bond between parents and kids, increase parents' abilities to use play to coach their kids on different skills, such as emotional, verbal, and academic skills, decrease harsh discipline and increase positive discipline strategies, such as ignoring, redirecting, timeout, and problem solving. Defiant Teens consists of 18 steps. Steps 1 through 9 teach parents effective strategies for dealing with defiant behavior. Steps 10 through 18 teach parents and teens to communicate and problem solve, while facilitating healthy independence for teens. The intervention is outlined in Russell Barkley's book for clinicians, Defiant Teens, and in this book for parents, Your Defiant Teen, 10 steps to resolve conflict and rebuild your relationship. Another intervention is collaborative problem solving or collaborative proactive solutions, CPS, which is built on the belief that keyword challenging behavior stems from lagging thinking skills. Thus, it's best to teach the skills they lack. CPS consists of 3 steps: identifying and understanding the child's concerns about a specific problem, identifying the parent's concern about the same problem, and having the child and parent brainstorm solutions together to find one that works well for both. Learn more at cpsconnection.com and thinkkids.org. Cognitive behavior therapy, or CBT, can also be helpful, particularly for older kids. CBT can help children and teens to regulate their frustration, learn and practice assertive behaviors, and improve social problem-solving skills. Parents can be present during treatment sessions and learn to be supportive in other ways, such as using praise and rewards for positive behavior. In addition, CBT can help with anxiety and depression, which can occur with ODD. Multi-systematic therapy, or MST, is an intensive home-based family and community-based intervention for 12 to 17-year-olds whose severe behavioral problems place them at risk for being taken out of their home. MST lasts 3 to 5 months. According to a 2016 article in the Journal of Clinical Child and Adolescent Psychology, MST identifies the individual, family, peer, school, and community factors that are linked directly or indirectly with each youth's disruptive behavior. MST then implements and individualizes treatment plan for each family that can incorporate interventions from empirically supported, pragmatic, problem-focused treatments, including select strategies from family, behavioral, and cognitive behavioral therapy protocols. You can learn more at their website. So when your child has ODD, it's critical to work with the therapist. Try to find a therapist who specializes in working with children and teens and someone you feel comfortable with. Don't hesitate to interview a variety of therapists, if possible. Ask them about the types of intervention they specialize in and how they go about helping your child. Now, there are some medications that can be used to help ODD. They don't usually use them, though, because the U.S. Food and Drug Administration does not have any specific medications just for this. But if you can control the ADHD that does go along with it, or the anxiety and the depression, that will help out. So that's all there is to that. As you can see on here, we've gone over before what the symptoms of ODD is and everything. So this is going to tell you a little bit. I hope it helps. If you do have a child or a friend that has a child, or you know somebody that has ODD and you want to help, look into the resources that I mentioned earlier in this. Just rewind and write down what it was. But remember, before I let you go, always see with your heart and not with your eyes, because when you see with your eyes, you're truly missing out. When you just use your eyes to see. Your eyes were meant to see beauty, don't get me wrong. What I'm trying to tell you is when you look into a person, talk to them with your heart and not with your eyes. Don't judge with your eyes. You need to judge with your heart, because your eyes can deceive you. There are people out there that are beautiful looking or handsome, however you want to put it, but on the inside they are as ugly can be. And that's why looks can be deceiving, and why we need to look with our hearts and not our eyes. It's just like a nut or a book. Let's take a nut for an example. You go to the store, you buy a peanut. Like the Mr. Peanut commercial, the shape of the peanut, okay? You can't tell if that peanut's good or bad by looking at the shell. You have to break open the shell to get to the peanut. We're the same way. You can't tell what a person's like just by looking at them. You have to look with your heart to see what they're like. Think. Use your heart. Your heart will tell you if a person is beautiful inside and out, or if they're not. Don't just go and trust somebody because you think they're nice. Look into it with your heart. Talk to them. Check with, listen to them with your heart. Always judge with your heart and not your eyes. And remember, until I see you again, I'm getting up close and personal. Yes, I am. Because each and every one of you out there matter. And I love each and every one of you for who you are. So until I see you again, bye. I love you all. Have a great day.